Good afternoon, everyone, and thank you for joining us for this month's Alamo Together Remote Summit. I'm Christy Wyatt, Associate Vice Chancellor for Communication and Engagement, and today we are going to be talking about our return to campus plan for spring 2022. Now, I know return to campus is not exactly accurate because many of us have been on campus for a very long time, working and teaching, doing what we do best and serving our students, but this is a transition to 100% back on campus. So back to our levels pre-COVID. And so it's been 2 years. We've done a lot of hybrid work and learning. We've been preparing for the spring semester, and we want to communicate with you all of the transitions that we're making, how we will begin to gather again face-to-face, and the safety precautions that we can all take to remain safe and keep our students and families safe. So this morning, we'll be joined by our board chair, Dr. Jean Sprague, our chancellor, Dr. Mike Flores, Dr. Barbara Taylor, who is associate professor of infectious disease at UT Health San Antonio. She joined us at convocation, answered a lot of our questions. So she's going to be back for another round of Q&A with us. And then we'll also have Associate Vice Chancellor of Human Resources and Organizational Development, Linda Boyer Owens, who's going to give a presentation about organizationally what we're doing to return back to our new normal. So at the end of the summit, Dr. Flores and Dr. Taylor and Linda will answer any of your questions as long as time permits. There's a chat button or Q&A button at the bottom of your screen. So use that button to submit any questions you may have. And so we're going to get started. I'd like to now welcome Dr. Jean Sprague for a welcome from the board.
Good afternoon. On behalf of the Board of Trustees, many of whom are joining us this afternoon to discuss our return to campus plan for spring 2022. Isn't that great? So with us today, we have our Vice Chair, Dr. Yvonne Katz, our Board Secretary, Clint Kingsbury, our Assistant Secretary, Gloria Ray, Joe Alderetti Jr., Anna Bustamante, Dr. Lorraine Polito, Leslie Sahanovich, Roberta Durante, and our student trustee, Asia Leha. So as the board chair, I'm proud of the Alamo College's district over the past 2 years of this pandemic and meeting the needs of our students. Your efforts have been both exemplary and recognized nationally. As we went to the national meeting of trustees, the ACCT meeting, everybody was telling us their woes of how long it took to adapt and how many students they lost and how their student success rate went way down. And we were able to say and actually put on some seminars about how quickly, thanks to your great effort, we were able to nimbly adapt. We didn't lose a significant number of students, and we actually increased our metrics of student success. So indeed, we are proud of what you accomplished. So now we're at the point where we'll be working to ensure a safe return to campus for students, faculty, administrators, and staff this spring. On behalf of the Board of Trustees, we would like to say we are proud of each and every one of you for your resilience and for your ability to adapt, both in coming in and out of the pandemic preparations. So thank you again.
Thank you, Dr. Sprague, and thank you to the entire board for your leadership during this difficult time, for all of the support that you provided us to help us continue to serve our students in the way that we do as one of the top community college districts in the nation. So I would like to now invite our chancellor, Dr. Mike Flores, to give some remarks around our return to campus.
Thank you, Christy. Good afternoon, and thank you, Chairman Sprague, for your words. And it's an exciting, I think it's an exciting time as we prepare for many of us to really be able to get together around a table next week and give thanks to what has been a challenging period of time, I know, in each and every individual's life, the lives of your family members, and definitely the connections that we have here at the Alamo College's district to be able to support each other and to support our students. But I think that we see after nearly 2 years, several different things that give us all hope and that allow us to prepare for a safe reentry beginning in January of 22. So what we wanted to do is to be able to communicate what that means for each and every one of you, and also what that means for our 65,000 students and how we came to that decision. And from the beginning, I think that we've been fortunate to have a collective of faculty, staff, and also individuals in healthcare and in the field, such as Dr. Barbara Taylor from UT Health, and working alongside and with individuals from the Metropolitan Health District, as well as from the city of San Antonio. And so one of the things that does give me hope is that the positivity rate right now within our community sits at 1.5%, which is very different from where we were in the summer, and in particular with the Delta variant, where we reached over 20. So to be at 1.5, I think in and of itself provides us with optimism. The other part is that the Alamo College's district, our positivity rate is 0.19. So those things, as well as the tools that we have for ourselves and for our families and for our community, are also known and are supported. And so 2 things in particular that we need to look at are the boosters that are now available and approved for the larger population, and also that vaccines are now available for children from 5 to 11 years of age. Those 2 things, along with the leadership, along with science and working in partnership with individuals such as Dr. Taylor, the city, and the Metropolitan Health District, are promising. So a couple of other things as we plan for the transition to spring of 2022 is that we have determined that we are going to begin to phase out health and safety screenings, including temperature checks, on January 14th. And we're also going to move from mandatory to voluntary COVID PCR screenings as well. The voluntary allows individuals, if they would like, to opt in to take the screenings to further ensure and enhance safety. We're also going to begin to increase the number of on-site events that we have on campus or at any one of our sites throughout the Alamo College's district, as well as other engagements and travel. We want to give our students and potential students the best possible services and experiences that they can have, and connecting with us. And as we all know as educators, education in and of itself is a human enterprise. So all employees should begin and plan over this holiday season to come back on campus. I know the vast majority are, and working in pods, but we would like for everyone to begin planning for a January 3rd on-campus presence, so we can welcome back 65,000 plus students to begin their studies and begin their journey with us, and also be able to welcome back at scale all 5,000 of our full and part-time employees. So I do want to assure you that the health and safety of each and every one of our colleagues, as well as our students, are paramount. We know more now than we have ever known, especially going back to spring break of last year and what that meant. So we have many, many things to talk about, and we want to assure, and I personally want to ensure, that each of you have your questions answered, and that we can all plan together to collectively support each other as colleagues, faculty, and staff, and also support each and every one of our students who are pursuing their dreams. But don't forget to also take the Alamo College's district pledge. And what does that mean? That means to get vaccinated. Perhaps you're already doubly vaccinated. You are eligible for a booster. That means to continue to wear a mask indoors where possible. That means to self-report COVID-19 exposure, and we do have contract tracing, and to quarantine as needed. So I did mention the positivity rate is 1.6%, which I think is very, very promising. But we also need to ensure that we continue to work together to lower the positivity rate. So I want to thank each and every one of you for your resilience over the past 20 plus months. And I want to thank you for your commitment to the Alamo College's district. Most importantly, I want to thank you for your commitment to each other, our colleagues, and for your continued support of each and every one of our students. And I think that's what makes the Alamo College's district so very special. Christy, I'm going to turn it over to you. Thank you all for being here this afternoon.
Thank you, Dr. Flores. And I know that we have a lot to get to, so I'm going to get right to it. I want to introduce our special guest, Dr. Barbara Taylor, who is a very good friend of the Alamo Colleges and our in-house expert on the Alamo Together Summit when it comes to COVID. Dr. Taylor is an associate professor of infectious disease and the assistant dean for the MD MPH program at UT Health San Antonio. She's an alumna of Princeton University, Harvard Medical School, and the Mailman School of Public Health, and she completed her residency and fellowship training at Columbia University Medical Center. Certainly a wealth of knowledge joining us. Now, during the pandemic, she served as the chair of the City of San Antonio and Bexar County Health Transition Team and is a co-chair of the San Antonio Metropolitan Health District COVID-19 Community Response and Equity Coalition, which works here in San Antonio, primarily on the pandemic response. And so I'd like to have her join us and give us an update on where we are here in town on when it comes to COVID, what we could do to protect ourselves, and what the outlook is as we transition back to our normal here on campus. Dr. Taylor.
Hi, good afternoon, everyone, and thank you so much for having me back. It is great to see you all virtually again. I'm going to share my screen, and hopefully you all can see my screen at this point. So talking about what the new year will bring is a little bit challenging in this context in COVID. So I'm going to be as upfront as I can about what we know and where our uncertainties lie as I go forward. These are my disclosures. I do have NIH funding to do both COVID prevention and COVID treatment research. And I am, as was mentioned, the co-chair of the COVID-19 Community Response and Equity Coalition with Metro Health. So for those of y'all who don't know me from before, my other disclosures are that I am a mom. I have a 6th grader and 11th grader in person in school in SAISD. I care for patients in the hospital, including COVID patients, but I also take care of patients in person, in clinic, and I'm also a teacher. And so literally this morning and several different times this week, I was in person in a class of 220 medical students. So where are we right now? I think it's important to sort of level set, as Dr. Flores already mentioned, where we are in San Antonio. So this is one of the representations from our dashboards. I highly recommend the City of San Antonio dashboards if you're wondering sort of what's happening in COVID in San Antonio. You can see that these are our weekly reported cases of COVID and then deaths from COVID. And we are here, which means that we are at the sort of end probably, or the low end of our sort of late summer Delta surge. We'll talk more about this in a moment. So as far as the what will 2020 look like, I would encourage you to be skeptical about anyone making very certain statements about the future right now. There is still quite a bit of uncertainty about COVID. I'm going to touch on treatment. I'm going to talk a little bit about herd immunity, and then I'm going to focus on prevention because that is one of the more amazing stories of the COVID pandemic. And then I'm going to talk a little bit cautiously about what even is the end of the COVID-19 pandemic. So first about treatment. So the good news is that we have treatment, which in some ways we certainly did not have 20 months ago. We have IV antivirals that work directly against COVID-19, as well as a wealth of anti-inflammatory drugs that we used for other things that now have been repurposed, and they're used in cases of severe COVID to calm down our own immune system response. And also on the horizon, there are oral antiviral medications that are coming out. There are 2 that are in the pipeline that we would expect to see in 2022. So I want to put those on your radar. Both are pills, and both have been shown to, in somebody who has COVID, who is not in the hospital, you take the medications, it reduces your chance of becoming ill or going to the hospital in small trials. These are the NIH treatment guidelines. They are revised very regularly, and folks like me who treat people with COVID really pay a lot of attention to where the science is going with how to treat COVID. So we're learning a lot of about both how to treat acute COVID and also more about long COVID. So there will be more to come on both of those things. So a couple of people have asked me, since we have these pills now that are coming out for COVID in the next sort of 6 to 12 months, can we treat our way out of the pandemic? And so the good news is that these more effective treatments will certainly decrease our risk of hospitalization and death. And it is very exciting for me to think about that. But the problem is that COVID gets transmitted even before you're symptomatic. And so there is an incubation period, and there is asymptomatic transmission or transmission before you feel sick with COVID. And so that is going to make it hard for us to treat our way out of this pandemic, because people might pass the virus unintentionally before they develop symptoms. So I think the answer to can we treat our way out of the pandemic is probably not. Will herd immunity get us out of the pandemic? There's a lot of discussion right now about natural immunity versus immunity that you get from vaccines, protection from an infection versus protection you get from a vaccine. So I think it's important to understand where we are with that and what it means. So basically what herd immunity, if you can see, this little person here has COVID and they can pass it to lots of other people. In the context of herd immunity, the person in the middle has COVID, but because the little pink people are all immune or can't get COVID, they can only pass it to one person. And this basically breaks the chain of transmission or the chain of infection in a community. So what are the requirements to get us to herd immunity? It means that a high proportion of the people have to be immune. They have to have protection against COVID, like in the case of the image on your right. Immunity also has to persist after infection. So you have to carry that protection for a period of time. Like we think about chickenpox, which you get and then you're protected. Immunity needs to be very protective. And I think the other really important thing to recognize is that we can't think of San Antonio as only San Antonio, or even the US as only the US. With a respiratory virus, we all, and I mean globally, affect one another. So if we have perfect control and herd immunity of our epidemic in the United States, we still have risk if COVID is propagating someplace else in the world. So we really have to think about this as global citizens. So the challenges in the context of COVID, and we will talk more about this as we go, is that immunity or protection against COVID goes down over time. We also have learned, in some ways, much to our surprise, that the protection that is conveyed by vaccines is actually better than the protection that you get after you've recovered from COVID. And we know this from clear studies. There's one in Kentucky that showed people who were vaccinated and got COVID versus people who had had COVID and got COVID again. And you were much more likely to get COVID again after having COVID and having recovered than you were than after you were vaccinated. The same type of finding was seen again in a group of healthcare workers, in a very large group of healthcare workers. So unfortunately, having COVID as an infection does not protect you as much as we would like against future COVID infections. So it is really unlikely. A lot of us had a lot of hope for herd immunity. I certainly did. 18 months ago, I was like, okay, we're gonna get there. We're gonna get herd immunity. But at this point, it is very unlikely that herd immunity is gonna get us out of the pandemic. What about prevention tools? So this is the real success story. We have had incredible advances in vaccines, and I know we've talked about this before. So we have genetic vaccines, the mRNA vaccines, we have viral vector vaccines, the Johnson & Johnson vaccine. We should soon have protein-based vaccines. These are similar to other vaccines that we have, like the hepatitis B vaccines. These are not yet available, so that is something that hopefully will be coming in 2020. And then we have public health measures. And one of the things we've really learned is that masking and testing and even social distancing, this is the KINS 5 social distancing guide that puts it in the context of tacos. So even distancing do make a difference. A very quick word on the role of testing, since you all are doing that at Alamo colleges and are changing how you're doing it. We continue to learn how to best use testing to protect our communities. And testing of people who have symptoms of COVID and easy access to that testing is always going to be important. In the context where there's a high community positivity rate, over 5%, that is also important to do asymptomatic testing, because that can be really helpful to prevent asymptomatic spread in close settings like classrooms. We've seen it work very well in skilled nursing facilities, in sports teams. I think we've all heard a lot about COVID in sports. Routine testing becomes less helpful when the amount of COVID in our community is low. So the low percent positivity rate right now for San Antonio is really encouraging, as are the low rates of positivity in your own testing within Alamo College's district. So asymptomatic testing is going to become less important. We can talk maybe a little bit in the Q&A about when you would want to do that. Do you want to do it before you visit someone who's immunocompromised or before you go to a family event? There are a lot of different contexts that we can use in which we can use testing to protect particularly the most vulnerable amongst us. We have really seen the effect of vaccines in Texas and globally. So these are data that came out just, I guess, almost a week and a half ago at this point about vaccination rates, or sort of cases and deaths by whether or not you are vaccinated or unvaccinated in the state of Texas. And so you can see that on the left, you have the number of cases of COVID, and you can see that even in the Delta surge, where people who had COVID before were getting COVID, we had a little bit more vaccine breakthrough. People who were fully vaccinated were much less likely to get COVID, whereas people that weren't had a 13 times higher risk. And similarly, and actually most unfortunately, which is what we have seen a lot at University Hospital in my work there, is that if you were fully vaccinated, there were some deaths, that is true, but your risk of death was 20 times higher if you were not yet fully vaccinated. So this has been the real struggle for us in community, is trying to work to message about vaccines and convey to people how important they are. So the other thing that we've learned is that vaccine effectiveness does decrease over time. So this is why the booster sort of recommendations are starting to come, and they really come out of data from Israel. So why are we talking about all these data from Israel? Well, so Israel had a very focused vaccine campaign where they vaccinated almost their entire population between January and April of 2021. They also have a very effective public health registry system, so they have data for the entire country. Also, everybody got Pfizer, so we're comparing apples to apples, not a bunch of different vaccines. So you can see that over the course between June to August, there were more breakthrough cases or cases in confirmed infection after vaccination than had been seen previously. So this, we believe, represents the vaccine becoming less effective over time. So this makes the COVID vaccine more like the flu shot or more like your tetanus booster, where you require a booster after a certain amount of time. They took a closer look to give you an idea of how, this is an alarming looking graph, but I want to give you an idea of the numbers. So in 1,500 healthcare workers, they tracked them very closely and they found 39 breakthrough cases. So a very small number still of breakthrough cases, so still very protective. all of them acquired COVID from an unvaccinated close contact. There wasn't transmission to others, and they were associated with lower antibody levels, which makes us think that there is waning immunity. This same phenomenon is starting to be seen among healthcare workers in the United States. So that brings us to current booster recommendations, which are, if you received Pfizer or Moderna, you should get boosted if you're over 65 or if you're over 18 and live in a long-term care setting or have an underlying medical condition. You may get boosted, that's the language the CDC is using, if you work or live in a high-risk setting. And the booster should be 6 months after completing your primary series. If you receive Johnson & Johnson, then you should get a booster 2 months after your first shot. You can get any of the vaccines as boosters. I would expect more changes to this within the next month. There may be a recommendation for boosters for everyone 6 to 8 months after your first vaccination series if you receive the Pfizer or the Moderna vaccines. Y'all asked me to touch briefly on vaccinations for kids. So there's a lot of concern for side effects in children because for kids, you have to think about, because kids are much less likely to become severely ill with COVID, you have to think about the risk benefit of vaccines, and the equation changes. You really have less risk of severe disease. And so you have to think, okay, well, is that still outweighed by the benefit of protection, and does it outweigh the risk of the vaccine? So what we have seen in the most prominent concerning side effect for children is myocarditis in 12 to 17-year-olds. We really have not seen it in kids under the age of 12. I also think it is really important to put this into context that we have seen there are about 54 cases per million vaccinations in this age group with the mRNA vaccines. But in COVID, we see a lot of myocarditis, 450 per million cases. So the risk of myocarditis, if you actually have COVID, even in this age group, is much, much higher. There are, however, a lot of myths about COVID vaccine side effects. So infertility is not caused by the COVID vaccines, nor do they alter your DNA, nor do they lead to death unless there is the rare anaphylaxis, and anaphylaxis we usually can treat because we watch people afterwards and give them treatment for that. So the concern for COVID in kids is that it is definitely worse than the flu, even in children. There is multisystem inflammatory syndrome, which is a rare complication, but present, and children can get long COVID or post-acute sequela of COVID-19. And these are sort of the number of cases per population of COVID-19. So kids, unfortunately, are still getting COVID. And this is cases by vaccination status in 12 to 17-year-olds, which show that vaccines do truly protect younger adults. So I've talked about vaccines. So the question is, will vaccines or prevention tools get us out of the pandemic? Well, they're the most effective tools we have, but we do have the continuing challenges that I mentioned with your immunity going down and then variants. And I see variants as sort of the Godzilla versus King Kong fight. But the good news is that even up until September of 2021, which was in the midst of our Delta pandemic, people who were vaccinated were very protected against both infection and death. So maybe vaccines will help us get out of this pandemic. So what does 2020 look like? So as I mentioned at the beginning, please beware of anybody who tells you exactly what tomorrow brings. At this point, it is most likely that we'll continue to live in a world with COVID-19. So this is the risk spectrum that we have talked about every time we've spoken. It highlights that it's impossible to create a framework in our current world where there's zero risk for COVID. None of us want to be this woman who lives in a box who only receives food by Uber Eats and never sees anyone. This is still a high-risk setting in our context, particularly if you are unvaccinated. But we do have to be careful about absolutes. There's not something that's no risk, but presented with the same situation, many people and rational people can make different decisions. So really what we're talking about is transitioning from, as much as we can, from a COVID framework into moving COVID into be something more like the flu, where we have a vaccinated population, where we can protect people who are most vulnerable to severe infection, and where we have some treatment that work even in the outpatient setting. So where are we right now in San Antonio? So we have come down from our Delta surge, which was here. Our percent positivity rate remains low. It's around 1.8. Hospitalizations have sort of plateaued. Some people are saying this is an uptake. I tend to say this is sort of over the last couple of weeks, we've had around 150 hospitalized people with COVID in San Antonio. So this is definitely something we should watch, especially as we go into the holidays. We also, I think, can purposefully prepare, continuing to deploy all the tools we have, but also paying attention to what we've learned. These are maps of essentially disparities in San Antonio that existed long before COVID-19. So we know that San Antonio has remarked disparities in terms of income that correlate with where our communities of color are living. These are zip code based maps from the new San Antonio Health Equity Atlas. I really encourage you all, if you're interested in health disparities, health equity, to look at this. And this is life expectancy in San Antonio, which is essentially a flip, where life expectancy on the north side of San Antonio is 10 to 15 years higher than life expectancy in some communities on the south side. This is an exact correlate with where we are right now with COVID in San Antonio. So I think it is really important to think about COVID and the continued impact that it has in our marginalized communities as we prepare for coming COVID surges and coming COVID, what we call endemicity. Thank you all so much for your attention, and I'm really happy to take any questions.
Thank you, Dr. Taylor. Just a wealth of information. I think it puts it into perspective for each of us. I know there are a lot of questions that are already being populated into the Q&A function, but before we get to the questions, I want to bring our HR, Chief HR person, Linda Boyer-Owen, to talk a little bit about the plans that we have in place. And then after that, we will get to a student perspective, which I think is a very important part of this discussion that we don't want to ignore. And then we'll get to questions. So Linda, please take it away.
Thank you, Christy. The sun is coming around the DSO building right now. Spring 2020, looking forward to it, looking forward to seeing all of you, and just thinking today about how much brighter things look this Thanksgiving than they did last Thanksgiving. We have really so much to be thankful for. Go ahead and go to the next slide. As Dr. Flores and Dr. Taylor have said, the San Antonio positivity rate has just been kind of staying well below 2%. For weeks and weeks now. The Alamo positivity rate, which comes from the screening of over 5,000 individuals a week, has been running under 1% per week. So that's great news for all of us who are here on site and all of our students who are here. Our employee vaccination rate that's reported through our incentive plan has 81% of our employees vaccinated across the college district today. And that's a tremendous accomplishment. We thank you all who decided to go ahead and get vaccinated and register. Go ahead to the next slide. Since November 2020, I mean, just looking back at how things were then and how things are today, it's so encouraging. This time last year, we didn't have the vaccines. We didn't have the boosters. We didn't have drug therapies on the horizon. We weren't able to muster really the large scale COVID testing capacity that we have today. We had a lot of gaps in our knowledge that have been closed over the past year by researchers like Dr. Taylor and others across the country. We're benefiting from that continuous education that we're all receiving from UT Health, from the city, Metro Health, the county, and CDC. So we're all really watching this together and staying informed, and we're adapting. I liked what Dr. Taylor said about if anybody can predict the future, you know, be a little cautious with that, because we definitely don't know where everything is going to go, but the highs and the lows are really leveling out. We can sort of see that trend, and the risks are becoming more and more managed, and that's just something really great for us to celebrate. Last year at this time, we were, I think, still kind of worrying that we needed to Clorox 360 every time somebody reported that they might have been exposed to somebody that had COVID. We've sort of grown past that knowledge gap. What we have learned and what so many of you have really committed to is masking. We've seen how masks make a difference, and so we thank you for doing that and making our workplace and our places to learn so safe for everyone. That's how we get students back to school and back to the process that we so love to work with them, that's changing their lives. Can we have the next slide? So as we return to campus in January, some of us will be coming back on January 3rd, and some of us will be coming back closer to the middle of January. But what we said, at least that's our plan at this point, is that screening for COVID will continue through January 14. We kind of wanted to get past that first week or two of school and make sure we really understand what's going on in the community and on our campuses in the new year. Screening will go voluntary after that. Community Labs has said that they can support screening for us through the end of the spring semester if we have individuals who need it and want it that long. I liked hearing that we might think of as individuals about when we should get screened if we're traveling, either for work or personal, that screening window every week is really a great benefit for us. And some of us just like to get screened at least once a week and may have that to give us a sense of security as we return to campus. So we want to keep providing that to you on a voluntary basis. Our daily health and safety screening checks will phase out in the spring. We've sort of gone back and forth here, I think even today, on whether that's at the 1st of January or whether we phase it out gradually, but we have that capacity. If we need it, we certainly can have it here. Our commitment to masking indoors will continue for as long as we're getting guidance from the public health professionals that's important as part of a multi-layered response to COVID as the situation improves. And then, of course, from our risk management teams, we always do exposure management. We don't have lots of exposures here in the academic environment, but certainly for COVID, if there's an exposure of something contagious, we do want to have it reported. We will do contact tracing. We have the capacity to do that, and we will quarantine to the extent that we need to keep our classrooms and workspaces safe. So let's go to the next slide. Look at what does this mean for operations. I think most of you are already kind of clued in on this. It's been in our COVID updates, but on-site instruction is really going to ramp up in the spring. We are expecting that a majority of our spring courses will be back on site as they have been. The colleges are striving to get at least 80% of their pre-pandemic face-to-face courses back up and running. So we'll be back at 80% of our pre-pandemic level for face-to-face. Our on-site services for students and our support operations across the college district and colleges and DSO employees will be back 100% starting on January 3rd, or perhaps a couple of weeks later, if you're a faculty member, you'll be joining us at a higher percentage on site. Go ahead and give us the next slide here. So what can you do as you think about this? I think these sessions and more information is so very, very helpful to help us all understand our own personal path forward in this journey to return to campus. But I would encourage you while you're thinking through that, think quickly. If you have already been fully vaccinated and you haven't registered in the portal, if you want the incentive of one additional personal day, or if you're a part-timer, extra $50 in your paycheck, go ahead and register by tomorrow, because tomorrow our portal is closing and that opportunity will be gone. If you need a booster, Dr. Taylor provided a lot of information here today. If you feel you're in that category, I'd encourage you to get one. I fell in that category. I got one. Nothing bad happened to me. I'm here and I feel good about that. Get your flu shot if you haven't done that yet. We always encourage employees to do that. It's just one less illness that we would not want to see you enter if you don't have to. Also think about preparing your office space and your technology to get back on campus or back in the office if you're not there already. Work with your IT team so that they're not overloaded the first week you return, so that they can get you all set up and connected and running well, so you can hit the ground running in early January. And beyond that, just have a great Thanksgiving. Thank you.
Thank you, Linda. Wonderful information. I think it is helpful to reiterate. Sometimes an email just doesn't say it all. So thank you for that. Now I'd like to welcome Ariana Acosta, who's a Northwest Vista College student. She's going to give us a little perspective from a student lens on return to campus. Ariana, are you able to join us? And she may be having some technical difficulties. There she is. Ariana, are you able to hear us? Okay, there you go. Hi, welcome. Are you able to hear us, Ariana? I think she's having some sound difficulties, so we're gonna move past. Thank you for joining us, Ariana. Maybe we'll get that fixed and come back to you if possible. So we're going to now transition to some questions and answers from Dr. Taylor, Dr. Flores, and Linda to clarify some things that folks are concerned about. So there are already a number of questions in the chat. There are about 12 questions actually. So lots of people have concerns. I think let's start with Dr. Taylor and the technical medical questions. So the first thing that folks are concerned about is the booster shot. I've received my shot, I've received 2 shots. When do I get a booster? I think high risk work area, does that include the classroom? Does that include folks that work in education? Can you talk to us a little about when to get the booster and who should get the booster?
Thanks so much for the question. Yes, and if you have further questions about boosters, because I do expect these recommendations will change over the next month, you can always go to the CDC website. And if you're like, oh, what is a high-risk worker? You can click on the link and it will tell you. But so what the current recommendations are, if it's been 6 months since either your Pfizer or your Moderna shot series, that you should get a booster if you are over the age of 65, live in a like sort of long-term care facility, or have a chronic medical condition. And that includes people with heart disease, people with lung disease, people with kidney disease, those sort of people with diabetes, those sort of things. So those are, you definitely should. You may is the words that CDC uses, but I will tell you, I did receive a booster. I do not fit those qualifications, but I work in a high risk setting. And that also applies to you all. So if you work in a classroom that is considered a higher risk setting, even though we actually fortunately have not seen a lot of transmission in schools and classrooms, but you also would qualify for a booster. If you got the Johnson & Johnson vaccine, if you were over 18 and it's been 2 months since your shot, you should get a booster. And that's the recommendation for the Johnson & Johnson vaccine.
And Dr. Taylor, can you get a booster shot or a COVID vaccine and your flu shot at the same time?
Yes, you can. So you are allowed to get them at the same time. There's no reason to not get them at the same time. And we actually haven't seen more side effects if you get them both at the same time. Some people might want to know sort of side effects of booster. Generally, and this is a very general statement, it's either about the same as your effects from your second shot, if you got Pfizer or Moderna, or for some people, a little bit less. I personally only know one person who had slightly more side effects after their booster. And the theory is that the reason we're getting boosters is because our antibodies have gone down. And so we are less likely to see side effects. But it looks about the same as your second shot.
And then how can we get that locally? Are there locations? Should you go to your doctor? Can we get them through UT Health?
You can get them all sorts of places. You can get them through UT Health. You can get them at CVS. You can get them at Walgreens. I'm not affiliated with any pharmacy. I'm just saying ones that are at the top of mind. You can get them at HEB. There are lots of boosters available in our community. So if you're interested, you can sign up online or in a lot of places you can walk in. I work at the Robert B. Greene downtown. You can walk in there and get your booster. One thing I forgot to say is that if you say, I received the Pfizer vaccine, but you can get boosted with either Pfizer or Moderna. So you don't have to look around and figure out what site is giving Moderna, for example. You can get boosted with whichever one is available to you.
Okay, thank you. I think that answers most of our booster questions. The next question is about surges. So we're seeing a lot of activity in Germany and in Europe where there's an uptick. We're also approaching the holiday season, which we've traditionally seen an uptick in cases. What should we do to prepare? What does that look like? Are there any indicators that you see that should make us concerned?
So I always worry about the winter season when it comes to respiratory viruses, putting people gathering indoors, it's cold, we're all inside together. We are going to see transmission. I think that traditionally, when we are thinking about COVID, we have thought about it arrived in Europe and then came to the US. And so Europe can be the thing that we look to be able to predict what happens in the United States. And I would actually caution people on that model in the current context, because what is happening, there are a couple things about what's happening in Europe right now. What's happening in Europe, in particular, what's happening in Germany, is they are having their Delta surge. So what happened to us in August, which was awful, is currently happening in Germany and some other places in Europe. It is still largely Delta. So could we see another surge? Definitely. I think for the US, especially for Texas, I would expect us to move along with sort of these, not have a huge surge, but move along with more cases, less cases, more cases, less cases as we go. Vaccines will still protect us unless there's another variant. If there's another variant that comes down where we could all get COVID again, then that will be another game changer, just the way that Delta was.
Okay, and my last question for you, as far as what's in the queue right now, is related to the condition that you talked about that perhaps our children should worry about, is myocarditis. Tell us a little bit about what that is and what the concern is around that.
So thank you for the question. I realize I lapsed into medical jargon and I apologize. So myocarditis is specifically inflammation of your heart. And we very commonly see it it's actually more common in young people, sort of late teens, early 20s, in the context of viral infections. So if you get flu or if you get COVID and you're in your late teens to early 20s, you can get this inflammation around your heart. Most people recover. In the context of the COVID vaccines, with the mRNA vaccines only, so with Pfizer and with Moderna, there were a very rare number of cases of myocarditis after people received the vaccine. So that was 54 cases per million, as opposed to 10 times that was what we see in COVID. And the vast majority, with one or two unfortunate exceptions, of those kids recovered completely from the myocarditis. So it is a very rare side effect of vaccines. It is unfortunately a very common consequence of viral infection, in particular COVID.
Okay, one more question that I think is very valid. Boosters, are we going to have them forever? So will it be like a flu shot where we have to continually get a shot every year? Or what does the outlook look like when it comes to vaccinations?
That is the question of the year. And if I knew the answer, I promise I would tell you, and y'all are gonna get tired of me saying we don't know, but the true answer is we don't know. I will tell you, I talked to virologists who are sure that we will require a booster for COVID every year. I also talked to virologists who are sure that this will be our last booster. I basically am saying, we have to look and see. We're learning so much from countries like Israel that vaccinated everybody really early. And fortunately, they're collecting great data for us, and we can learn from that. And so we're gonna have to see. And the closer we get to a better understanding of what antibodies actually tell us whether or not we're protected, we get more like we have for the hepatitis B shot, where I can do a blood test and tell if somebody is protected against hepatitis B and give them a booster if they need that. I hope that we get there with COVID.
Thank you, Dr. Taylor. I've read hundreds of articles and I've been watching the news and I feel just extremely informed. I feel like all of that was so confusing and I didn't know where to go or what to believe, but I think this has been really valuable in helping me to move forward, and I hope it has been for our viewing audience as well. And so now we're going to switch gears to the operations side. Linda and Dr. Flores, the question of the day, I know you know what I'm going to ask. What about potential to work off-site? So we've learned a lot. We've been able to adapt. We've been able to provide services in new ways. So our employees want to know, what is the future for potential remote work?
Well, I think the future is that we need to determine the possibility of remote work and physical on-site work based upon our student patterns, right? So I think we're fortunate that we've discovered there are new ways to organize ourselves, to connect with each other, and to support our students. It can come in this way virtually, or it can come in this way through our phone. And so that's what we're trying to plan the next best step related to virtual work. But first it begins with, what will student course taking look like in January of 23? What is the number of students that want to connect on site? What is the number of students that will continue taking internet courses? And I think one of the things that we've learned through COVID is how many students still want to connect in this way through a Zoom synchronous course. And as we look at that, the other part would be then to figure out, once we determine that from a student point of view, then how do we organize ourselves to support students and to support each other? So I would expect that we would begin to have more information as we go through the spring in preparation for next academic year, so for August of 23. And then the other part is not only virtual work, but the conversations that we're having relative to well-being, relative to all the stress that everybody has undergone themselves, their household, within the last 20 plus months. And so what does that look like? I think the other part, if we look at it when we get our paycheck or submit leave, right? We have a few categories. So we're here every day, or we submit vacation, we submit sick, or we submit one of 2 personal leave days. But sick leave would be the physical manifestation of stressors that we feel internally, right? And so I think there's a way for us to be proactive and to look at mental well-being and to be able to address that as well. So there are, I think, many questions. I saw the Q&A box pop up in the number of questions. And so there are many things. And I would tell you that we are looking at those and we have been engaged in conversations as a leadership team, but most importantly with your collective leadership, with faculty and with staff leadership to be able to figure that out. And I look forward to more conversations with students along the way as well. So Ariana, our student trustee, Asia Leica, students in classrooms and talking about what that means, because I think that's critical as we plan the ways we need to connect to support our students and each other.
And so on the flip side, we talked a lot about the employee side of working on site, but what about hybrid learning and services online? Is that going to be encouraged and continued for our students' convenience or as an option for them?
Yes, I think that's the other part is how do we do that? And then the other, because I saw that pop up, there is Dr. Taylor mentioned something with regard to equity, and you could see in the heat map, right, the propensity of certain things. And what took me aback again is just life expectancy within the city, is that you see that relationship in which there's a difference of up to 15 years, as you could see, between the north side and the south side. So there are also equity considerations in what we do. The other part that we need to look at is for virtual work is what types of jobs are eligible for virtual work. I think all of us were fortunate or many of us were fortunate that we could, during the onset of the pandemic, connect virtually. But there were many individuals in many types of jobs that did not have that ability. And so we want to be able to take a holistic look internally of the job types and to ensure that there is an equal opportunity to avail themselves of whatever we add to our portfolio of benefits and options for individuals. And so that takes a little bit more of a deeper dive, but I do want to assure you that we are looking at that, and there have been conversations about what that looks like going forward.
So the next question is a call for a definition. 100% on site. What does that really mean? Does that mean I'm coming in 4 days a week, 5 days a week? Does that mean I'm still in my pod? Can we explain exactly what that means to our employee group?
I would say that means that on January 3rd, we would have everybody on site if their job was on site pre-COVID. So that everyone would be able to come back to the college or the DSO or any of our centers and be able to interact with individuals face-to-face. I thought what was interesting is Dr. Taylor mentioned all of the things that they've done at UT Health, but in particular, the ways that she's interacted with students, with colleagues, and with patients, and largely face-to-face, and then when needed through different venues, right? So I think education is a human enterprise. I think there is something that we're able to do by being together in the classroom, in the lab, and connecting on campus as well. So that would mean that everybody should make plans to be able to return and to join us, and for us to welcome our students back wholesale starting on January 3rd. Linda did mention, right, obviously staff come back on the 3rd unless you've made accommodations to take additional leave, and then faculty come on contract after that date. But the vast majority of folks will come back at the beginning of the year after holiday leave.
Okay, and I want to get to Ariana, but before we do, one last question. This one's probably for Linda. Folks that need ADA accommodations, or maybe it's not ADA, maybe you're going through chemotherapy, or you have some situation where we know that a lot of folks, the vaccine doesn't work for them because of a certain autoimmune condition or other extenuating circumstance. What do we do? What do we have those folks do so that they can keep themselves safe, but also continue to maintain their employment?
Yeah, thank you. Thank you, Christy. We always have a small number of employees who have a medical condition like that, and they need to work remotely. We've always worked hard to accommodate those employees using the telecommunicating policy that we have in place. You can fill out the request. It's online in with the policy and procedure on the Alamo website. You can fill that out, submit it to your supervisor with the proper documentation, and it will go to your administrator. And if they are able to accommodate remote work for you, they will do that. It's not terribly common, but it's not terribly uncommon either. And it's a system that's always worked for employees. So we're happy to work with you.
Okay, and my last question is for Ariana. If you're able to join us, I would love to hear from you. We've talked a lot about how we're preparing as a workforce, as your teachers and your support staff to come back and give you what you need as a student to be successful. And I know that you've been on campus and you've been taking classes and getting services on campus. What can you tell us? What is it that you can say to us from a student perspective of how we can be supportive to our students as they come back on campus?
Can you hear me?
We can hear you, yes.
Did you? Now I can hear you. Yes, you can. Okay.
Go right ahead, Ariana.
So with the support, I personally have felt that my connection with my professors are very important because if I understand their expectations for in the classroom and how their personal lives are also being affected by COVID, I can accommodate my life and kind of prioritize my work around how they want it to be and do my work as best to my ability while also having them empathize with me and understand that COVID-19 does have an impact on my life, as well as the other students in my classes and within their lives and their families as well. So having professors that can sympathize and really put themselves in a student's shoes is, it's very important, not only for the academics of the student, but so the student can socially be inclined to participate in clubs and have a community where they feel like they belong and they're comfortable doing extracurriculars and their studies.
And is there anything else that you can say that we should do? Are there any other things that we should do, even as staff, as advisors or others who work with students, to ensure that you all feel comfortable and supported as you return?
I would say to keep the COVID-19 guidelines. We have been in place since the very beginning. I know my transition has been from high school to college since I am a first year. And I felt very comfortable with the weekly testing and the weekly reports that I get within my emails, letting us know how many COVID-19 cases there are. So continuing to do that, I think would make me feel safe for my physical health. You know, when we check in, we get those wristbands that indicate that students and professors don't have not only a fever, but other symptoms of COVID-19. So if we continue doing that, I would feel safer continuing doing classes on campus.
Okay, well, thank you, Ariana. Those are valuable insights. I know that empathy is so important in this time. Everyone's mental health is paramount, and we've seen that with students that they're struggling. We're all struggling too. So I think that's really something we can all take to heart. Thank you again for joining us, Ariana. Thank you to Linda, Dr. Flores, and to Dr. Taylor for the wealth of information. I hope that you all have a great holiday, and we look forward to seeing you in person next semester.
Thank you all. Bye-bye.